When a person with asthma comes into contact with something that irritates their airways, an asthma trigger, the muscles around the walls of the airways tighten so that the airways become narrower and the lining of the airways becomes inflamed and starts to swell. Sometimes sticky mucus or phlegm builds up, which can further narrow the airways. Common triggers include house dust mites, animal fur, pollen, tobacco smoke, cold air, and chest infections. The recognition, signs and symptoms: shortness of breath, coughing, difficulty breathing out, wheezing, distress and anxiety, difficulty in speaking, grey-blue skin tones, may become exhausted. Let's now look at the treatment.
Asthma is a very serious medical condition and immediate action is required. Firstly, help your casualty into a comfortable position and, if possible, a sitting position. This is leaning slightly forward, taking pressure off the chest wall. Then calm and reassure your casualty. The most important consideration with an asthma attack is to encourage the casualty to use their own prescribed medication. This is usually in the format of a reliever inhaler. The blue inhaler is the most common colour for the reliever and medication. However, the casualty may have other medication and this may be in a different colour. The casualty is usually able to direct you with hand signals towards their inhaler because speaking will be difficult. If the reliever medication has no effect, or if the attack lasts more than 5 minutes, or in fact it is the casualty's first attack, then you should call 999 for an ambulance.
So, in summary, very distressing for all. You may feel very helpless. Sit your casualty up, leaning slightly forward. Use of their own medication, usually a reliever inhaler. Calm and reassure.